Uganda has made strides towards the fight against HIV and AIDS, and on World AIDS Day, the Uganda AIDS Commission announced improvements towards meeting the global indicators.
We are at 90, 94, 94. But, Your Excellency, this target is by 2025. When we reported to you in Rukunjiri, we were at 89, 82, and 78. We had just come out of COVID. So it also points to the impact of COVID on us. So I trust that on this target, Your Excellency, the one remaining year, we shall come very close to achieving it, the 95, 95, 95 by 2025.
However, the UNAIDS counter representative said the goals so far are not representative enough.
We are not achieving these targets for men and for children, for young people. Men and young people are likely to know very late that they are HIV positive. They are likely to fall out of treatment, and they are more likely to die of AIDS as compared to women. So this achievement is not for everyone, and we need to ensure that it is for everyone.
Dr. Matovu's study could be one of the interventions. In the 2-year study from May 2021 to April 2023, they worked with peer leaders to influence their colleagues to know their status.
And our intervention shows that when you identify local men, people in the communities, and you train them in how to distribute HIV self-test kits, you train them in how to interpret results, they can reach out to fellow men and give them HIV self-test kits. In this case, we gave them, each peer leader was given up to 2 kits to give to each person who had been selected, and a total of 800 HIV self-test kits were distributed. Of these, we actually found that 99% of the men who received the kits used them to test for HIV. And we were able to verify that because we asked the men to bring back HIV self-test kits that they had used.
He says the study was important to reveal why men in hard-to-reach areas do not seek healthcare services.
It's because the health facilities are very far away from them. Yeah. Because these are people who are living on islands very far away from the fishing communities. While our approach was successful in reaching them with kits and 99% tested, then the percentage of those who went for HIV care, who were newly diagnosed as positive and went for HIV care, was 71%. So some 29% did not go, and the reason was related to transport.
They were also able to establish that the prevalence in the 2 areas was at 14%, and that the activities there have an impact on its rise.
With the highest prevalence recorded in Kalangala district at 19.5%, and then Buvuma was 9.5%. Alcohol use in terms of the women who migrate to the islands, and in one case, as part of this study, we actually found that 58% of the men we interviewed in 2021 in those 2 islands reported engaging in sex with 2 or more partners. But when we asked them, did you use a condom? Only 13% reported using a condom consistently at every sex act.
While speaking on World AIDS Day, Dr. Stephen Waititi, who represents people living with HIV in Uganda, said stigma is what has kept many away from knowing their status.
We know stigma is based on myths and misconceptions about this disease, and the only way we can help our people overcome this disease by giving them correct information consistently.
Uganda AIDS Commission, working with the National Message Clearing Committee, reviewed and revised the messages, and the Minister for Presidency has issued guidance at both national and local level, Your Excellency. And the leaders are using this. We are especially working with RDCs to make sure that these messages are put out and our people continue to be educated. The emphasis on education and awareness campaigns has contributed significantly to changing society attitudes, reducing stigma, encouraging people to speak out, as we've just seen today, and seek treatment.
Walter Mwesigye, NTV.